because exposure response prevention is the name of the type of therapy that's used to treat anxiety and OCD situations, where it's very, very well thought out beforehand with preceding therapeutic sessions to outline what level of distress an individual is going to experience with different scenarios. And so just plopping on a virtual headset is not really how it works in a clinical respect. It's much more logical and progressive, where you start off with very, very lightly distressing situations and work your way through that so that individual can gain a sense of confidence and they feel like they have control over the situation, and they can sequentially march through each subsequently more challenging scenario. Otherwise, obviously, it's going to backfire and they're going to lose trust from that clinician and not want to go forward with any more environments. And in real life, in vivo, clinicians have to become very creative. And say an individual has a fear of flying or a fear of standing on a train platform, and you're in a city that doesn't readily have one available. What do you do to mimic that scenario when those aren't readily available to you? It's very, very difficult because you're trying to come up with elements that model the scenario but aren't actually the scenario. And in VR, you can do that with a click of a button, and it's just kind of a no-brainer because you can quickly alter the size of individuals, the number of individuals, animals, objects, heights and spaces, and presence of protecting elements that on a top of a building, or et cetera.